Hi, I'm Dr. Breen, and in this video, I want to discuss perimenopause, what it is, and what you need to know. This morning, I had a 51-year-old woman who came in complaining that her periods were becoming more irregular. She went from being normal every single month to having 2 in a month, and then this month being 15 days late. She asked me to check her hormone levels and give her my thoughts. By definition, perimenopause is the time between when you stop having normal regular menstrual cycles and go into full-blown menopause, when your periods stop. We refer to this as no man's land, in that anything can happen and anything that happens is normal. But typically, women will tell me that they sense an imbalance in their hormone levels. Your menstrual cycles may come every 2 to 3 weeks, and the bleeding pattern has changed. Some women will say that their periods are very heavy, and others will say that they're very light. In addition, women comment no matter how hard they train or how clean they eat, they just can't seem to lose that last 10 to 15 pounds around their abdomen. Many times they experience insomnia for the first time in their life. You could be snapping at your spouse more often than you're used to and walking around feeling irritable. There are days when you feel so hot and sweaty that you need to change your clothes. You may have little to no interest in sex, and when you do, it could be painful because you're experiencing vaginal dryness. You may even have hot flashes or night sweats. So, what is the first step? If you think you are perimenopausal, the first thing I recommend is that you schedule a GYN exam to rule out any pathology. And once you get the okay that there's no underlying pathology causing the irregular bleeding, the next step is to have your hormone levels checked by a doctor who specializes in bioidentical hormone replacement therapy. So what causes the symptoms of perimenopause? The symptoms of perimenopause are caused by the imbalance of circulating levels of hormones produced by the ovaries under the direction of the hypothalamus and pituitary gland in your brain. Your ovaries primarily make estradiol, or estrogen, progesterone, and some testosterone. These 3 hormones have effects on every cell in the body. So an imbalance in the 3 hormones can cause the symptoms that I just described above. The primary imbalance that we see in hormone levels is changes in progesterone as a result of not ovulating every month like normal. Ovulation typically occurs on day 14 of the menstrual cycle and is the process of the ovary producing a viable egg to get pregnant. If you do not ovulate, then you do not produce the same amount of progesterone. And as a result, you have an imbalance between circulating estradiol and progesterone levels. This is what typically causes the majority of symptoms in perimenopause. So what can you do to treat hormone imbalances? The first thing we do with women who are experiencing the symptoms of perimenopause is give them bioidentical progesterone to take either daily at bedtime, or you can also take them on days 14 to 28 of the menstrual cycle. Most women will prefer to take progesterone daily because they feel so much better on it. Progesterone will generally reduce hot flashes and night sweats. It is very calming. It will get women sleeping soundly. We then make sure that your testosterone levels are optimal to help stimulate your sex drive. They'll help reduce body fat and also gain lean muscle. The most important thing that women need to do during this period is exercise and eat as clean as possible. Cutting out sugar and alcohol is a must if they want to get through this period of time without gaining 10 to 15 pounds of abdominal fat. We then monitor your hormone levels regularly. And based on the levels and your symptoms, we'll add estradiol at the appropriate time. So how long will perimenopause last? This is going to be different for every woman and will depend upon their lifestyle, genetics, and how well they take care of themselves. I've seen women who start perimenopause in their late 30s and it persists into their early 50s. But for most women, this period will last 5 years or less, and if treated appropriately, will be very tolerable. Unfortunately, conventional medicine is treating women with birth control pills or antidepressants or recommending partial total hysterectomies because they have not been trained in prescribing bioidentical hormones. The reality is that many women right now are experiencing these exact symptoms and are not getting the treatment that they need. So, in summary, you should schedule a GYN exam and have your hormone levels checked in the blood by an expert in bioidentical hormone replacement. You will then want to start taking progesterone either daily or in the second half of your menstrual cycle. Then, if you can cut out 90% of the sugar from your diet and exercise regularly, you can come through the other side feeling great and unscathed. So, if you'd like to schedule a consult with me personally, simply give us a call at 877-721-0047 or visit us on the web at breencenter.com. Lastly, if you enjoyed this video, please click the like button, subscribe to our YouTube channel, and if you know a woman who's suffering from perimenopause, feel free to share this video with them.
For more details and information, please contact us at 877-721-0047 or visit the FAQ section of our website at www.breencenter.com.